And now he's really complaining that he cannot sleep. What I'm doing isn't working, and he has to cancel the day, cancel rehearsal, everything's going to be thrown back, and we have very little time to take his show to England. And at that time he said, I'd like to have some milk.
Milk? And about what time was this?
He said, please give me some milk so that I can sleep, because I know that this is all that really works for me.
Hot milk or warm or just?
This is just a medicine
What
that
is,
he was familiar with.
what is the medicine?
It's called Propofol.
Propofol, okay.
Yeah.
So how do we spell that, doctor?
Propofol.
And what is this Propofol?
It is a sedative that could also be used for anesthesia.
Okay, and how is that? Is it injected as well? Or?
It is both given in an intravenous form. Usually most patients are given a certain amount of the drug based upon body weight, and then they can be started with an infusion slow enough to keep the levels in the plasma up so that they can sleep.
So you gave him this Propofol.
Yes.
Do you remember about what time it was now? The last time I got was about 10 o'clock when there was still no effect, and he's complaining he's going to have to cancel.
I knew, I looked at the time, I looked at the sun, and I saw 10:30, so I would say roughly 10:40. Because I'm looking at the time I started treating him, and all that I have given him to this point, waiting for the effect and everything else, and I'm not seeing any effect. And I looked at the time because I also knew that if his day is to be made productive, he also has to get up by a certain time. And as he and I spoke openly, and he was, there's no sedative effect with all that he received so far. I said, if you got Propofol now, which of course he referred to as the milk, how much time, how much sleep you expect to have? You're going to be needing to be up no later than noon. And he said, just make me sleep, doesn't matter what time I get. I thought what would happen to your rehearsals and your schedule for the day. He said, I can't function if I don't sleep. They'll have to cancel it, and I don't want them to cancel it, but they will have to cancel it. So I agreed at that time that I would switch over to the Propofol.
This is the first time now that you're using this?
First time, yes. And I would give him a small amount that would help him to sleep, and then see if the effect would be there.
How much did you administer initially?
25 milligrams.
Okay. And again, this is approximately 10:40 now, give or take.
Well, by 10:40 we have discussed that nothing is happening. So by the time I would draw it from the bottle, get it diluted, I had to dilute it, and usually I dilute it with lidocaine, LIDOCAINE, because it could be it burns the vessels in the sense of the side effect it causes it to burn. And
I'm sorry, you gave him how much now?
25 milligrams.
In always the same way, regardless of what you were giving him was
I pushed it.
Okay. Okay. And I'm sorry, I interrupted you, but we were getting towards the time. At 10:40, you realized that nothing was happening, and so by the time you got your things together and you pushed it,
It wouldn't take a long time for me to just withdraw from a vial dilute it with the lidocaine, which is a local anesthetic agent that, also is a sodium blocker to make him not feel the burning sensation of the slow injection. So I had a total of medication mixed with the lidocaine, and I administered.
Did it take you about next 5 minutes or 10 minutes?
Slowly infuse. Slowly infuse over, I would say, 3 to 5 minutes. That's good. Because the effect is going very quickly.
So we're looking like at 10:50-ish.
Yeah. Yeah, the effect is going very quickly. So the effect is only lasts about 15 minutes.
Okay, so now we're roughly 10:50, 11 o'clock. What takes place next?
Well, he is now asleep.
He does go to
He
sleep.
now goes to sleep.
When you did this, while you were administering to him, did you actually have any precautions that you took? Any monitoring, machines or anything like that?
Yes, I took all precautions that was available to me. Since I started seeing him, I made sure that there was oxygen at the bedside, that he was placed on oxygen every night by a nasal cannula. I had a pulse oximeter, which is a plastic tube that goes over the finger or the toe. It's a device. It is battery operated that shows me the oxygen saturation level, and also beat by beat dynamically shows me the heart rate for the patient.
You said pulse oximeter.
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 O-X-I-M-E-T-E-R. That registers the amount of oxygen that he has in his blood, and it also helps me to look at the heart rate. So those things are in place.
You were doing it this evening, throughout the night?
Yes.
This particular time?
Yeah, constant
And he had asked for this particular drug, this
Referred to as milk.
Milk, yeah, this is called milk. He had asked for this before, and you knew how he reacted to it. You've given it to him before.
I've given it to him before.
And he handled it fine.
He handled it fine.
Same dose?
The dose and the drip. Not the same dose in this case, because I had given him earlier Versed. I had given him the Ativan at different times during the night, and I know that their half-life is not as short as lorazepam, so I took every caution, knowing that there was possible of all of the medication still on board. So the 25 milligram ordinarily would not be the dose I would give him if he did not have those other agents on board. I would give him a higher dose.
Oh, okay, so it's a lower dose than normal.
Yeah.
What's the highest amount of milk you've given in the past?
Well,
These other agents went in.
based upon his weight, it would be weight-based, and the highest amount I had given him initially, direct on the IV before starting the drip on him, would be twice that amount, which is about 50 milligrams.
Okay, so it's approximately half of what you've given him before.
Yeah. But I have the dose here to be cautious, as there were other medications given to him during the night, which also induces sleep, and he had there was no response or effect.
Can you recall off the top of your head approximately how many other times he's received this milk and handled it fine?
Well,
that you've given it to him, not that other doctors have.
I had given it to him.
Is it more than 10 times?
Yes.
Okay.
Much more than 10 times.
More than, well, how far back we going now? Time span wise. It was in the last couple of months you were contacted, right, initially
2
by
months.
Amir and for this tour.
2
So
months.
in the last couple of months.
2 months.
Okay, you've administered it more than 10 times.
Yes.
More than 20 times.
30 days a month, roughly, every day.
Oh, almost
It's about the daily.
But daily, with the exception of 3 days leading up to his death, I tried to wean him off
Okay.
that medication.
And let's be clear. Let's make sure that you guys ask this question if you don't mind.
Sure.
Before you were hired on as his doctor, were you aware that Michael Jackson was taking this on a daily basis?
I was not aware that Michael Jackson was taking this on a daily basis, but I was a little bit surprised of his pharmacological knowledge, because that is not an agent that most people pulls out from their hat. And he explained to me that he had taken it multiple times. He used it frequently on the stores. It was given to him by multiple other doctors. He knew exactly that we had to have anti-burn. Anti-burn was his word for the lidocaine, because he said whenever it was injected, he called it anti-burn, which was the word for lidocaine, because he said whenever it was injected into him or it was running into him, infusing, it would set his limb or wherever they act on fire. And asked me if I ever had it, and I said no. And he said, well, I'm just letting you know, without the anti-burn, it's really uncomfortable. So make sure that there is always a lot of that available. But he was speaking from a source of experience. And he also said that he'd used it in Germany and several other places. Never really truly disclosed the doctor's name.
And that's something that you understood that was administered by a doctor, not Michael himself? Or could it?
He never told me that he administered it himself. But he had said to me that the doctors allowed him to infuse it himself. And I refused him that opportunity. And he asked me, why did you want me to push it? I love to push it. It makes me feel medicine is great. I said, well, if I'm going to give you an agent that is going to put you to sleep immediately, and it can be so quick to act, I don't want to ever let you infuse such a substance when I'm present. I'll do that. So sorry about the other doctors who've done this. I would not.
So I know what the answer to this question is, but just to that, I'm not assuming. The first time that milk was used on him, was it your idea or was it his idea?
His.
He knew how much to put in. He knew what it was. He knew how to inject it. He knew all that.
Yes, and he knew that that was the only thing that worked for him. Now, I constantly cautioned him that it is an artificial way to go to sleep, and it would be nice to get him back to a more physiological state. Like most people, when they work and they're tired, they fall asleep. And he'd ask me, he said, could you sleep like that? And I said, no doubt about it. Most people sleep. I do understand that children have a better sleeping habit for REM sleep than adults, and as we go older, we don't sleep as well and as long. And sometimes patients need a help sedative that they will use as needed. And that's okay. But I said to do this on the frequency, I tried to counsel him away from that.
Do you happen to know, I'm sorry to interrupt guys,
That's fine.
But do you happen to know who his doctor was, with any name given of a doctor before you were hired on?
Yes. And mind you, he told me that there were a couple of doctors in Germany, and they would high-five each other and do different things, so based upon substances that he got. But prior to starting with him in May, he came to Vegas sometime in March or April.